So early in my career, fibromyalgia was this disorder that I want to say people laughed at it. Like, I think the men that taught about fibromyalgia thought it was like, yeah, and those women, they have fibromyalgia. And so it was placed under the connective tissue umbrella, which it was also lectured about fibromyalgia next to myofascial pain syndrome, which would have trigger points. The difference between fibromyalgia and myofascial pain syndrome is tender points with fibromyalgia. So like it's tender, but it doesn't refer pain. Myofascial pain syndrome, you touch a tender spot and it can refer to another place. Now, early in my career, I believed definitely in connective tissue disorders. I had many women on my caseload with fibromyalgia. And what I noticed with these women, and this is my personal experience, is that the people that have fibromyalgia had like crazy range of motion, buttery skin. They broke if they looked at something wrong. They sneezed and threw like a rib out. They rolled their ankle in their driveway. They were klutzy and they didn't mean to be klutzy. And I even remember calling one of my patients with this fibromyalgia Tumbelina because she could like fall anywhere. Now, read that as poor proprioception. If you've been following me on this platform, you know that that kind of sounds like someone who has a connective tissue disorder. Connective tissue disorders would be hypermobile EDS, which has 13 different subtypes. It could be mixed connective tissue disorder, but it's a genetic thing where your body codes your type 1 and type 3 collagen a little funky. I always think of these patients as Stretch Armstrong or Gumby, and so their connective tissue is loose. So if you envision your body constantly being pulled apart, you become irritated. If you know that the part is being stressed all the time and not being efficient, you can develop arthritis, joint pain, tendonitis because you're not being an efficient machine because you're a loose goose. Now enter COVID. COVID causes widespread inflammation and myalgia, muscle pain, joint pain. It's inflammation. So there is this kind of resurgence of people being diagnosed with fibromyalgia. But I honestly think fibromyalgia doesn't happen as much as one might believe. I believe connective tissue disorders are much more rampant than we ever thought. 10% of the population might have EDS, but COVID's an inflammatory disorder. And if you're having a moment, you are inflamed from COVID, and maybe you don't have fibromyalgia. Also, I have a lot of people that have rheumatoid arthritis that didn't get diagnosed in a timely manner, and now they're having lots of other issues. So fibromyalgia is real, but I always recommend seeing specialists like a rheumatologist, if you can find a good one that likes you and will use words and speak with you. And if you think you have EDS, you need to see a geneticist or rheumatologist for diagnosis.